overcrowding in Limerick reached a new record level, not just for Limerick itself. It actually did reach a record level for Limerick itself, and the next day it reached a national record for the whole country. And I raised this issue of the necessity of some kind of an independent review with the Taoiseach. And he seemed to take the idea on board and said that he'd refer it to the HSE and to the Minister for Health. So I suppose why I've raised this today along with my colleagues, my independent colleagues from the region, is to ascertain what is happening with this independent review. Are we going to proceed with it?
HIQA is closely monitoring the overcrowding situation in a number of hospitals, including at Limerick over the last number of weeks, and has had recent correspondence with the hospital group CEO regarding their evaluation of the current factors influencing crowding in the ED. HIQA have also written to the HSE senior management to highlight HIQA's intention to initiate inspections under the national standards for safer, better healthcare.
Thanks very much for your reply. I suppose, scant as it is, HIQA has a certain remit, and I don't think HIQA has the remit to recommend that Model 2 hospitals be upgraded to Model 3 hospitals. HIQA doesn't have a remit to look at the population, if there is a population growth, if the population of a region is greater than anticipated when originally planning hospital capacity. So while I welcome the fact that HIQA is closely looking at this, I have two questions for you. One is, will this correspondence, which is going over and back, will that be published? Because I don't think any of us want to go through the jig of looking for it through freedom of information. I mean, ultimately, there has to be accountability by the government and the permanent government and the HSE and HIQA for the delivery of health services in this country to democratically elected representatives. So can we see that correspondence? And secondly, do I understand that the idea of a review is no longer being considered? Because if that's the case, I'm very disappointed, because while I respect the work that HIQA was doing, their remit is limited.
I will follow up with that today and try and get you a substantial answer, because it just says, in relation to the question of a review of UHL, HIQA is closely monitoring the overcrowding situation in a number of hospitals, including Limerick, over the last number of weeks, and has had recent correspondence with the hospital group CEO regarding their evaluation of the current factors influencing crowding in the ED. And both deputies, I will bring your concerns to Minister Donnelly. Thank you.